Hi guys, welcome to my YouTube channel. It's Slily's here and I'm back with another video. If you are new here, welcome. Thank you for clicking on my video and I hope you will love it here. Don't forget to click on the subscribe button so that you can join the family. And if you are a returning subscriber, thank you so much for coming back. I really appreciate you guys. Thank you so much for supporting my channel and I'm so excited to have you guys here on this video that I'm doing today. So today I'm doing another video where I compare cesarean section versus natural vaginal delivery. And in this comparison video today that I'm doing, I will be focusing specifically on how you can recover from whether you had a cesarean section or you had a natural vaginal delivery. So today will be all about recovery. If you've had a natural vaginal delivery, how should you take care of yourself in the weeks following your birth? And if you've had a cesarean section or a C-section, what can you do in order to have a good recovery in the weeks after your birth? So that's what we are talking about today. So if you are pregnant and whether you're going to have a cesarean section, a planned one, or you're going to have a natural vaginal delivery, or at least you hope to have a natural vaginal delivery, things don't always go the way we hope that they would go, by the way. But yeah, whichever delivery method you might have, in this video, I will be discussing how you can recover. What are the practical things that you can do to avoid infections, to avoid any complications, whether you had a C-section or a natural vaginal delivery. So without any further ado, let's get on to the video. Okay, so let's start with the natural vaginal delivery. So if you've had a normal birth, what are the things that you need to look out for, and what are the practical things that you need to do in the days after your birth or the weeks? Yeah, days to weeks after your birth, right? So in order for us to talk about that, we need to determine the area that is affected the most when you have a natural vaginal delivery or a natural vaginal birth, right? So the area that is affected is your vagina and your perineum, right? Because that's where the baby comes out. So I'm going to insert a clip or a picture right here of the anatomy of the vulva. So the vulva, it's the genitals of a woman, basically, that consists of the clitoris, the labia majora, the labia minora, which are the lips of your genitals, and your clitoris being in the middle and your vagina being there at the bottom, as you can see in this picture. So now, between the vagina and the anus, that's where your perineum is. And that area between the vagina and the anus, called the perineum, is the one that most women have tears, right? Let me repeat that. A lot of women have tears, or they basically tear in that area that is between the vagina and the anus, right? So some women can have some tears on the inner section of the labia minora, which is the smaller lips that are surrounding the clitoris, and they're also surrounding the urethra where the pee comes out. So some women, they can have like some small lacerations or small tears over there, and then other women can have a tear that starts inside the vagina that extends outside to the perineum, right? So that's an area where your skin is open, there is risk of infection, and we need to keep that area closed because we don't want the woman to lose blood. So what do we do to safeguard that area from infection and from blood loss? We stitch that area up, and a lot of women, they've had stitches if they've delivered naturally. And most women, they get some tears, more especially in their first natural delivery. And then some women in the consecutive deliveries, they don't tear that much, or they don't even tear at all if it's like a second pregnancy and it's a second natural vaginal delivery. But if you have given birth naturally and you had tears and you had to be sutured, the most important thing that you need to do is to take care of those stitches. Now, firstly, most of the time, in fact, I think all of the time, absorbable sutures are used to stitch that area. And if I can find a video that shows how, or a picture that shows how those stitches look like, I will try and insert it over here. But mostly we use absorbable sutures, so that means that you won't have to go back to the clinic a few days after you give birth to take those stitches out. They absorb right into the skin, so you don't have to worry about anything. What you do need to worry about though is the risk of infection. You don't want that area to get infected. So what you should do is to clean that area properly. You need to clean that area properly. Now, to clean that area that has your stitches, you can use lukewarm water. You add coarse salt, and you can have something that we call sitz baths, right? So that salt and the water, it's very good at cleaning the area, taking away bacteria, and also the warmth of the water, it can also help with some of the pain and the inflammation. But it has those antibacterial effect. It has that antibacterial effect of cleaning up the area, taking away any dead or anything that could cause you an infection. Right, so you need to clean your stitches in that way. Do those sitz baths. You can maybe in a tub of water put your salt, and then you just sit and you let that area just be cleaned by that water. And then another thing that you can do as well, after you pee or after you use the bathroom, the toilet, to do number 2, you can just have a spray bottle of like warm water, and maybe you can put some of your coarse salt in there, and every time after you use the bathroom, you just spray that water mixture with the salt over that area, just to keep it clean. And then after you do your sitz baths, like after bathing or after like spraying that water, you just lightly pat the area, because most likely it will be very painful to the touch and very sensitive, especially in the first few days. So that's how you clean that area. And then you need to look out for any signs of infection, pain, redness in the area, any pus or discharge coming from the stitches, any swelling and inflammation. So it's redness, pain, swelling or inflammation, and any pus or any discharge coming out of that area, and a high temperature, so a fever of more than 37 degrees Celsius. Look out for those things. If you have any of those signs, you could be having an infection, and you need to go see your doctor or your midwife straight away if you have any signs of infection. So that's the first thing that you need to do, or that's the first thing that you need to think about when it comes to recovering from a natural vaginal delivery. Second thing that you want to do very early on after you give birth is you want to pee. As soon as you are able to, go and pee. So the peeing straight after delivery will help to just take away any bacteria that stayed around that genitalia area, because after you give birth, there's so many things that that were there, you know, bacteria, blood, fluids, all sorts of fluids from your delivery. So definitely you want to pee to avoid getting a urinary tract infection. And it also helps when you pee for the first time after you give birth. It will also help to take out any remaining clots that you might have in your uterus from your delivery. So that's the second thing. Make sure you pee, drink lots of water, and yeah, so that your bladder can start working and you can pee a lot and you can flush out any bacteria that might have gone up your urethra that can put you at risk of having a urinary tract infection. So that's the second thing. And then thirdly, another thing that you do need to look out for after you've had a natural vaginal delivery is your blood loss. You need to monitor your blood loss in the hours after delivery and in the days after delivery as well, up until you reach 6 weeks. So after you give birth, the bleeding will be a bit on the heavy side, and as time goes by, it will slowly decrease. So in those first few hours after delivery, you at least don't want to bleed too much that you soak 2 pads. Some sources say you don't want to soak 2 pads in less than an hour, or you don't want to soak 1 pad in less than an hour. So that's another thing that you need to look out for, your blood loss. How much blood are you losing, and are there any blood clots that you are passing? So that's very, very important to prevent a certain complication that would result from you bleeding a lot, which we call postpartum hemorrhage. So we don't want you to have postpartum hemorrhage. So that's why you need to monitor your blood loss after delivery. Ensure that you're not bleeding a lot. So obviously, the first pad that your midwife will put on you right after you get off the delivery bed, that one you need to change it as soon as possible, and then you need to pee. And then after you change that first pad, then you can start monitoring properly now the blood loss and how many pads are you using in a certain amount of time. And if you are soaking more than 1 or 2 pads within an hour, that means you are bleeding heavily, and you definitely need to notify your midwife. And by that time, you will still be at the hospital. So it's very important to be aware of that. And then some people, because they have stitches in that area of the vagina and it's very close to the anus, if you have stitches there in your perineum, some other people will be scared to go to the toilet and pass stools. They might have that fear that it will be painful, and as a result, some other people can become constipated. Or you can also just be constipated because of the hormones that you have after giving birth. So another thing that you can do, if you are able to, you can ask your doctor to prescribe stool softeners for you, so that you don't have to struggle with hard stools and then you have to strain and cause a lot of pain to the stitches that you've just had because of that close proximity of the perineum and the anus. It might be painful to pass hard stools those first few days. So something that you can do is to ask your doctor or your midwife if they are able to prescribe a stool softener for you, so that you don't have to worry about straining. And also, if you are struggling with constipation, you don't have to worry about that or go through all of that unnecessary pain. And then another thing, when it comes to natural vaginal delivery, and if you've had stitches, you are not supposed to have sex, at least for the first 6 weeks after delivery. It gives you time to heal. Your stitches, by that time, they would have healed. It takes about 7 to 10 days for those stitches to heal, for your wounds to like close properly, your stitches to heal and be absorbed. So you still need to give your body tissues time to heal, even after your stitches have been absorbed. So it's advisable to not have sex within the first 6 weeks after delivery. You can do Kegel exercises to try and strengthen those pelvic muscles. And Kegel exercises, basically how you do them is you go in pee, and right in the middle of passing urine, you try and stop the flow of the urine. So you hold your muscles and stop the urine right in the middle of peeing, and then you let go. So that's an exercise that you can do to just strengthen those pelvic muscles once again, since you've given birth to a whole baby and a whole human being has gone out of your vagina. So you might feel like things are a bit loose down there. So just to tone those muscles and strengthen things a bit, especially if maybe you also feel like you are struggling with incontinence, like urine, you get oopses every now and then and your urine just comes out, you can do those Kegel exercises just to strengthen everything and pull everything back. Yeah, and basically, obviously, because you've had stitches there and a whole human head has come out, you will have some pain. So you can take paracetamol for the pain, obviously as advised by your doctor. But with paracetamol, you don't need a prescription for that. Everybody has paracetamol in their house, so you can take some paracetamol for the pain. But obviously you don't want to take any medication, even if it's medication that you can get over the counter. You don't want to take it for a prolonged period of time. If the pain is too much to the point that you have to take paracetamol every day, then maybe you should visit your doctor. But for the pain, you can take basic paracetamol, 2 tablets if it's 500 milligrams, so 1 gram every 3 times a day or every 8 hours. Yeah, and you can also try to use some ice packs if the area feels so painful and swollen. You can use some ice packs and just put them on that area. But if the pain is too much, go see your doctor. It could be that you're having an infection. So yeah, I think that's about it when it comes to a natural vaginal delivery, the recovery, and how you can treat your stitches. I think that's it. So now let's move on to the cesarean section. How do you take care of yourself? What are the things that you should do to take care of yourself after having a C-section? Okay, so with the C-section, the area that is affected is your abdomen, right? Your lower abdominal area. Let me put a picture up here so that you guys can see how a cesarean section looks. The preferred incision type when it comes to a cesarean section is the horizontal one or low-lying one. I just need to find out what name they actually give that incision type, but that's the type that is preferred. Cosmetically, it's a very good incision type because it heals better, and once the scarring goes away, you can barely see it. It's below your bikini line, and sometimes pubic hair ends up covering that area, so it's easy for you not to see it in someone who's had a cesarean section, as opposed to the incision type that is horizontal and that goes on the longitudinal aspect of your abdomen. So yeah, the incision usually low-lying, so they will make an incision there and you'll have your stitches there. So sometimes they will use actual stitches that will need to be removed after some time, or some doctors will use staples to close that incision. But what happens is that when the doctor does your operation or finishes with your operation, the doctor will put, or your surgeon will put a dressing on the wound, and that dressing, usually you can remove it after 24 hours after your surgery, right? So and in that 24 hours you rest a bit, because you might be actually feeling quite tired. You might have a catheter just to empty your urine. You might be in a lot of pain that you can't get out of bed in those first few hours after your cesarean section, and you have that dressing there. And then also after some time after your surgery, you'll be able to start eating and slowly get back to eating and your normal body state before the operation. So after 24 hours, that's when you will remove the dressing. And how you clean the dressing or the incision site is basically, it's advisable to take a shower after you have a cesarean section. Take a shower, just let the water run down, and that should be enough to clean that area. And then you can just wipe it damp when you are done showering. And then it's also good to give your wound or your scar some air. It's good to wear loose fitting clothing so that you don't put any strain or any pressure on your stitches. Wear loose fitting clothing. Don't carry heavy items that weigh more than your baby. It's advisable that when you cough or when you sneeze, just hold that area a bit. And then after some time, you will start mobilizing, you will start moving, walking around, and you will get pain medication, and you will be in pain. You will be in pain. After that, anesthesia that you got for the operation wears off, you will start to feel the pain. And while you are still in hospital, you are going to get pain medication. And even after you're discharged, it's advisable to continue taking that pain medication as prescribed. Don't take it only when you feel pain and then you skip. It's advisable to take it as it is prescribed. If it's prescribed 3 times a day, take it 3 times a day. Don't wait for the pain to get to its peak and then you want to take the medication. You need the medication to be at a constant level in your system so that it can combat the pain. So pain is a very, very important aspect, especially if you've had a cesarean section. I mean, it's a major operation. You've just had an operation. Your body just got cut, like your skin and your organs, they cut them. So you are going to be in a lot of pain. But yeah, you will get pain medication. Use the pain medication as prescribed. I don't know how to stress this enough. Yeah, don't limit your movements. Yes, you need to start walking and mobilizing. Keep mobile as much as you can, but also take it easy. Don't overwork yourself. Don't lift heavy objects heavier than your baby. Take it easy. Take it easy. So the stitches, there are layers of stitches that you have after a cesarean section. So when you have a cesarean section, you have the incision or the cut in your skin, and then there are the layers that are below your skin, and then your uterus will also have its own cut where the baby had to come out of. So the stitches that are inside will take longer to heal than the ones that are on the outside on your skin. So even though you might see that your outer skin incision is healing, and it will heal within 5 to 10 days, and if you had like stitches or staples, usually you will be told to go to the clinic on day 10 to remove your stitches, right? So on the outside, you will see your skin is healing, the wound is healing, but on the inside, it takes a bit longer for those stitches on the inside to heal. So that's why you need to take things easy. So as with the women who had a natural vaginal delivery, you need 6 weeks for your body to fully recover from the effects of childbirth. So in those first 6 weeks, you still need to take it easy. Give your stitches time to heal, even the ones on the inside. As much as you can see on the outside that your skin is healing, the incision is healing, but give yourself enough time to heal even from the inside, right? So I have already touched on how you will clean the stitches on the outside, right? So even with the cesarean section, you do need to take note of the signs of infection. So it's the same even with the cesarean section: pain, redness, swelling, fever, any pus that is oozing or any discharge that is oozing from your incision site, right? It's advisable you can clean your incision maybe 2 or 3 times a day if you can. Even with the vaginal delivery, you can clean your stitches. Maybe you bath 2 a day, which preferably would be great, especially because you are healing, you're going through this process of healing. Clean your stitches or bath 2 a day, right? Yeah, so basically those are the things that you need to keep in mind if you've had a cesarean section or you've had a natural vaginal delivery, especially when it comes to the stitches or the wound that you might have. And now just one other thing that I want to touch on quickly on this video is that make sure you have support after you give birth. Make sure you have someone at home who is going to help you with the baby. Because there's so much that you go through after you give birth. You have this new responsibility, which is the baby. You are a new mom. You have to take care of this baby. You might be a wife and you have your husband and you just have a whole household to take care of. And there are chores, there's cooking, there's taking care of the baby. And as a new mom, you need a lot of rest. And now you might be having this baby that doesn't sleep at night, because babies don't sleep at night. You need to feed on demand. You need to feed the baby on demand at least every 3 hours. So that means that you might not be getting a lot of sleep at night. But the nice thing is that babies sleep during the day. As much as they are awake at night and they wake up so much, a lot of babies just like sleep throughout the whole day, especially in the first few months after birth. So you do need someone who's going to help you and help you with things like chores in the house, like cooking, and then maybe you can focus on the baby. But you really do need a lot of support, guys. This is very, very important. Being a new mom is not something that is easy. I know I'm not a mom. I haven't been a mom yet, but it's a lot of work. It's a lot of work. You constantly need to be looking at your baby, constantly need to be feeding them, constantly need to be soothing them. And at the same time, you need to take care of yourself too, right? There's just so much. You have all of these hormones that are all over the place. You are exhausted, you are fatigued, you are low, or you're running low on sleep. So you do need someone to prepare your meals. Make sure that your house is clean, so that you can get some time to sleep. You can have time to take a shower, When the baby sleeps, you can have some time to sleep during the day and take a shower. But the reason why I'm mentioning this aspect of support is that mentally being a new mom, it's not easy. And actually, I think even if it's your second or third baby, it's still a lot of work. It's still a lot of work that you have to put in as a mom, and your body is also going through a lot, trying to recover from the whole process of childbirth and now the demands of being a mother. So there is something that is called postpartum depression, and you really need to take care of your mental health after you give birth to a baby. That's why I say that it's very important for you to have enough support as a new mom, because it might start to feel quite overwhelming. And you might be having all of these hormones. You might be feeling so emotional. You might start feeling like you can't take care of your baby, or you might start feeling like you're not doing a good job. and it can even get to the point where you might actually feel like harming yourself and even harming your baby. It can even affect the emotional bonding and attachment that you have with your baby. So very, very important, as you are doing all of these things, have help. If it's going to be your mother who's going to come and help you after you give birth, or your mother-in-law, on top of having your partner around, but you need a lot of help. You need a lot of help, and only you will know how much help you need. But if you are married, great, you have a partner that's there all the time. But also, I think it is good to have someone extra on top of your spouse to help you out, because both you and your spouse might still be trying to figure this thing out. But yeah, I mean, ultimately it's your decision how much help and support you think you need. But I really think that it's important. And also look out for postpartum depression while you are trying to avoid all these other complications, like having an infection post-delivery or having postpartum hemorrhage. Yeah, so it's a long journey. It's a long journey of recovery after you give birth. But the primary goal is to get through that first 6 weeks after delivery. And if you can get through that first 6 weeks, then from there onwards, things will start to get better and your body will start to go back to its normal state even more, and you'll start feeling like yourself. You'll start to get a hang of how to take care of your baby. But yeah, I wish you new mommies all the best, and those are the tips that I think I can share with you guys today. I don't want this video to be too long, and I already think that it is going to be so long. I mean, obviously there's so much that can be said, there's so much advice that I can give, but I think in this video I just wanted to focus on how to take care of your scar, your primary scar, which is your stitches, or if you had tears, and your cesarean section scar or wound, right? Yeah, so that's basically all I wanted to share with you guys today, and I really hope that this video will benefit someone. And if you have enjoyed this video, and I hope you have listened up until the end, yeah, if you enjoyed this video, please do give it a thumbs up. Please subscribe to my channel. Don't forget to click on the notification bells so you don't forget or you don't miss out on any new video that I post. And yeah, man, I love you guys so much. Thanks for tuning in. Until next time, bye.